Do you have Temporo-Mandibular Disorder, also known as TMD? Are you confused about which medical professional to go to? Which treatment is best? Or have you been to many medical professionals and they all say different things? Watch this video to see what your patient journey should be and the key medical professionals that can be involved. To make sure you get all the correct information, all the medical professionals in this video have a special interest in TMD and they are all evidence-based. Enjoy.
Hi, I'm Andrew Sywattam. I'm a consultant maxillofacial surgeon in the East Midlands and specialise in temporomandibular disorder management. One of my other roles is as the NHS England and NICE advisor for the government in setting guidelines for temporomandibular joint management. One of the issues with that role is that there are thousands of papers on TMD management. The vast majority are just case reports or personal opinions, and therefore there is a very limited amount of good quality research in this area. I've sifted through that research and written guidelines for NICE and for NHS England on the basic management of temporomandibular disorder. What that would involve usually is rest, anti-inflammatories applied topically over the joint, and muscle massage, and in addition a lower splint to wear over the teeth at night. The vast majority, probably 80% of people, will get better with that, and this treatment should be instigated by your dental practitioner prior to referring on to any more advanced service. Thank you.
The temporomandibular joints are such a unique and fascinating pair of joints. At its surface it's a ball and socket, but actually it has both a hinging and a sliding action with a very special and unique disc in between the ball and socket, which if you've ever had any clicking or popping, that's the disc jumping on and off.
Taking a history from you is crucial to understanding you. We are going to delve into understanding what the causes or any timeline for when the pain started. It may be related to trauma, such as a fall, or maybe related to social activities such as rugby or football. Also, being aware whether you grind your teeth can help us understand whether there is some minor trauma going on repeatedly. We're also going to look at your medical history. Is there any medical conditions that link to TMD, such as fibromyalgia? We will also look into your dental history to look for any potential dental causes. We will also analyse your social history. We want to know about you. What's going on in your life? We want to know about stresses, such as job stresses, or even personal stresses. Sleep is also important. Are you a restless sleeper? Do you snore? Do you wake up feeling like you've held your breath? There's a positive link between sleep apnea and TMD symptoms. When it comes to signs and symptoms of TMD, we're going to focus our questioning around three main elements: pain, noises, and movement. Pain, normally we'll find that the pain is focused around just in front of the ear. And we want to know if it radiates anywhere else, such as the head or the neck. How long has this been going on for, and is there any particular triggers for it? What is the character of the pain? Is it a sharp pain or a chronic throbbing pain? Any other associations such as clicking or limitation of movement? Is there a pattern to the pain? Do you find that it's worse in the morning or throughout the day? And does anything in particular make it worse or better? When it comes to the noises, we want to know if that noise is consistently there or only there intermittently. So the noise will either be like a clicking or a grating noise. Because it's close to your ear, your feedback is more important to us. When it comes to movements, we want to know if there's a restriction in the movement and is there any locking of the jaw. Now the lock can be either one where you cannot open or where you cannot close. When it comes to headaches, we want to also understand that you've been to see your GP and they have not found any cause for the headaches. This is important.
Assessing the TMJ starts with the muscles. During an examination, I'll palpate the muscles that grind and clench in order to determine whether the patient is grinding and clenching. When it comes to looking at the joint itself, I'll ask my patient to open and close. And there's two things I'm looking for. Firstly, I'm feeling for any clicking or popping in the joint itself. And secondly, I'm looking at the path of the mandible to see if it deviates. If the mandible deviates to a side, it's typically to the side that is affected.
So one of the reasons you may get jaw pain, facial muscle pain, shoulder pain, backache, neck ache, is if there's a conflict between the position where the muscles would like to guide the jaw into a nice relaxed position and the teeth want to guide the jaw when they close together. This can also manifest in night clenching or grinding, otherwise known as bruxism. Some of the ways this can be alleviated is by wearing a muscle relaxation appliance over the upper teeth, which stops the teeth guiding the jaw into a conflicted position. We can also carry out some minor reshaping of the teeth, so they're not guiding the jaw once again into the incorrect position. Or we can reposition the teeth with some orthodontic treatment. And in conjunction with this, physiotherapy to the facial muscles tends to help a lot as well.
During an orthodontic assessment, your orthodontist will be examining the temporo-mandibular joint, the position of the teeth, and the position of the jaws. Some patients that have prominent teeth will tend to slide their jaw forwards to mask the fact that the teeth stick out. This causes a strain in the muscles around the joint and can also cause clicking of the joint. If you are experiencing clicking or muscle tenderness, it's important that you mention this to your orthodontist.
If you think you have a temporomandibular joint problem, it is very important to make an accurate diagnosis. The best way to do this is with an MRI scan. It is very important to scan both joints at the same time, as often when you think you have a problem on one side, it is very often related to a problem which you've had on the other side, which has been present for a long time and has not been diagnosed. These are images of the temporomandibular joints. They demonstrate the joint in the closed and open mouth positions on the right and left-hand side. Focusing on the right, the disc is clearly seen to lie in front of the condyle and has a very abnormal appearance. The condyle is irregular and degenerate, as is the eminence, with widening of the joint socket. On the open mouth position, the condyle does not move as far as it should. It should go past the eminence, but it is stopped by the disc which lies in front of the condyle, and this is called a non-reducing disc.
TMD physiotherapy is considered to be conservative care. This means before you have any invasive or irreversible treatments for TMD, you should try physiotherapy first. So what should you expect from a physiotherapist? Well, first make sure they have done some training in TMD, as this is not taught at undergraduate level. Then the specialist TMD physiotherapist would assess your face, head, neck and shoulder, and then devise a treatment plan that works for you. Treatments include low-level laser, dry needling, TMJ mobilization, posture re-education, and spinal mobilizations. This treatment, alongside splint therapy, helps most TMD sufferers.
So the vast majority of TMD that presents in primary care is related to muscle pain, what's called myofascial pain. This relates to the muscles of mastication, which are largely the masseter, which attaches here, and the temporalis, which attaches in the temple here with the jaw joint here. So a lot of the pain will be a dull pain over the lower jaw, just here, or upper jaw, just on the temple. This can be managed simply initially with muscle massage. That can also have added management with physiotherapy, where they stretch the muscles and manipulate them into a better position, or injections of botulinum toxin, Botox, into the muscle in 3 spots on the mandible and 3 spots on the temporalis, which relieves probably about 70 to 80% of people's myofascial pain.
And don't forget about the brain. As a psychologist, I think the brain is a very important factor here because it's directly linked to muscle tension, which is directly linked to TMD. The brain has an area called the amygdala, which detects any threats in the environment, and it's also the area that trauma is held. It can carry many active triggers and causes stress, anxiety, and subsequent increased muscle tension. There's also an area called the hypothalamus, which is important here. It links to the pituitary gland, which tells the adrenal gland to release cortisol to the body, the stress hormone. Cortisol runs through the blood and tells other parts of the body to respond to stress, which can include muscle tension. Often I find with my clients that the muscle tension is held around the head, neck, shoulders and chest area. And of course the TMJ lies right at the crux of all of that. There's an increasing amount of peer-reviewed research that links psychological impact to TMD. For example, Kim et al. Relates higher levels of symptoms of TMD to previous traumas. There's also links between anxiety and TMD in multiple research papers. There's one more important part of the brain that I want to show you, and that is this prefrontal cortex. This is the thinking part of the brain. This is the area that helps us make sensible decisions and regulate the amount of stress and anxiety going on through our body. And this is the bit we try to work with in therapy. We link this area that releases stress and anxiety to thinking it through and being able to process and regulate our bodily responses. And so really, therapy and psychological interventions do need to be considered when treating TMD. There's a range of research evidencing that certain types of psychological interventions are particularly helpful, such as CBT for anxiety and stress levels, psychotherapy for processing trauma, and mindfulness as a branch of CBT to really help focus healing and relaxing of muscle tension, in particular joints around the body. So what I would say is don't forget to consider psychological interventions when working through how to treat your TMD.
So if you look at where the temporo-mandibular joint is, it's actually very close to the ear canal. And if you take your little finger and put it in your ear and open your mouth, you'll be able to feel the joint itself. So that means that when we're talking about pain in the area of the TMJ, you want to be thinking about whether a problem in the outer or middle ear can be the cause of that pain. And similarly, when I see patients coming with ear pain, I want to be thinking about whether the temporo-mandibular joint might actually be the cause. So it's important to involve an ENT surgeon specialising in otology whenever you're thinking about that sort of possibility.